Ito nga, since it's a Thursday today, of course. Lilinawin natin si Doc Joseph ay isang urologist doctor. Tama?
Yes.
And urologist is not exclusively for men.
Yes.
Diba?
For women.
What is urology, the study of, in a few words?
Okay, it is the specialty is a subspecialty of general surgery wherein it deals with urological problems from the kidney down to your lower urinary tract.
So hawak mo kidney down to
the bladder, to the ureter and the urethra, and up and some of the reproductive.
Male or female?
Male and female.
Both.
So problem na to, for example, yung topic natin na urological emergencies during pregnancy would fall under you, not the OB-GYN.
No, most of the time kasi, Diego, tama yan, no? When is a urological case a gynecological or OB? Kasi when you talk about pregnancy,
it's
that
OB.
is obstetrics.
Usually OB,
Kasi
yes.
ang obstetrics and gynecology, dalawa rin yan. You have to see, the obstetrics is the normal female physiological activity, meaning pregnancy, sa obstetrics yan. Gynecological, andyan na yung ninang yung tumors, yung mga, yun yung mga may malalang sakit, yung mga, these are gynecological.
Kaya pala may doctor na title, obstetrician lang.
So parang, yes, obstetric. There is meron yung parang oncological gynecology. Ibig sabihin mga cancer ng female genitalia, mga ganyan.
So parang ano yan, to simplify, pagka manganganak ka lang, as in panganganak lang.
Obstetrician.
Oo, yung parang gynecologist mo ang gagawa, di ba?
Obstetrician.
Obstetrician.
Pero pagka may iba na problema, kunyari, buntis ka pero may problema ka sa kidney, sa pag-ihi.
Sa kanya, kasama na.
Oo, kasama. Kaya minsan, kasi tama yun guys, we have to define kasi there's a lot of attachment na. Kasi meron din na OB-GYN o yung gynecologic na uro. Meron na tayong urogynecologic specialty. Ibig sabihin, that gynecologist is a uro specialty. So, ano siya, nagsesegue siya sa subspecialty namin.
Hindi na kinukuha niya yung trabaho niya.
Oh, I think we have a guest si Doktora
one specific example kasi after ko manganak, instead na OB yung tinext ko, si Doc Joseph yung tinext ko kasi alam ko hindi ako makaihi nun. So yun pala yung tinatawag na UTI in pregnancy.
Prostate. Kaya nagulat ako. Prostate.
Alam ko kaya mo tinext si Doc Joseph.
Sabi ko, hindi to OB eh. So, ang una kong thinking was Doc Joseph. So, tinext ko agad si Doc Joseph.
naman kasi kayo, manganganak lang kayo, kailangan nyo pa OB.
Isang kami manganganak sa kamadrona.
Sino magpapaanak?
Hilot na lang, pwede.
Uy, kaming tatlong magkakapatid.
Ako, pinanganak ako sa hilot.
Sa bahay lang
Ako, sa bahay din ako.
Tatlo kami magkakapatid.
Ako nga, nung bata ako,
Midwife
ako
pala.
nagpapaanak ng kambing namin.
Kuya, kambing yun.
Ibig ko sabihin, di ba? Ang daming mga asamin sa baryo, ang daming pinapanganak, pinapatawag lang si Aling Gelang.
Ikaw ba, kuya? Ano nagpaanak sa'yo?
Sa akin?
Nurse or kamadrona?
Di ko alam kasi ako pinaanak eh. Bata pa ako.
Ang problema kasi, kuya, sa hilot, kasi most of the time, ang people that goes, lalo na yung sa rural area, go for hilot kasi, which we do not advise that much. Lalo na pag ang posisyon ng bata ay breech, yung paa. Suhe, no, I call that. Kasi pinipilit nilang maging cephalic, yung ulo ang lalabas. Sometimes kasi, hindi kasi yan ang position mo eh. You have to define kasi minsan sa kakahilot, pero yung pelvic brim mo, yung lalabasan, hindi kaya kasi maliit. So you might go into a cesarean section. Sa kakatagal mo ng hilot, labor, baka later on, mag-acquisite yung bata sa loob, and you can end up having a stillbirth. Kasi matagal na eh, prolong, no? So magme-meconium stain na siya, di ba? Yung greenish. Exactly. Pero
kasi nung araw, di ba, wala naman kasing mga OB na ganyan.
Walang mga ultrasound pa.
Wala.
Midwife.
Mga OB.
Mga midwife.
Sa bagay kasi noon, mas madaling mga nakababae. Isang iri lang. O ganun. Ngayon parang Kasi sa dami ng mga kung ano-anong mga kinakain, kung ano-anong mga...
Mas mahirap nga kasi ngayon, kuya, kasi like you take care more of the laboring woman or mother, mas matagal. Lalo na kaya that's why hindi namin pinapayagan ang mga asawa sa loob ng labor room. Kasi pag sumigaw yung ng ano, ayoko na honey, saan asawa ko? Ang tagal. You tend to, ang dami kasing mga senaryo pa.
Tapos mumurahin pa yung asawa niya. Hindi ka na makakaulit. Itahon na ito.
Talaga next year, andyan na naman siya.
Ako din, hindi ako gagalit.
Ako hindi. Galit ka.
Galit ko.
Pero hindi
Ayaw ko maalala. Asa na si Diego? Asa na? Asa na?
No, I didn't do that.
Tawagin natin, OB natin.
Okay.
Lalo na kuya, di ba? Pag galit na galit, matinding
baka
labor,
iba yan. Okay.
pinapalo yung husband pag nandun, di ba? Ginaganyan.
Basta ako, ang naalala ko kay Arlene na sinasabi niya kagad, sabihin mo ha.
Bikini cut.
Tapos, dinadala na sa operating, sinabi mo na ba?
First plan.
Tanong naman yun eh, before ka biyakin. Before ka biyakin, ano gusto mo? Bikini o patayo?
Ako hindi na.
Ay, kasi
Emergency.
At saka mas
Anyway, pag ano natin.
So ano po yung mga urological emergencies?
Okay, ang ano natin kasi tama sabi ni Rina yung isa rin. Kasi most of the time, we have to know first, yung physiologically, meron tayong sinasabing physiologic na nangyayari sa kidneys natin during pregnancy. One is you can have like namamaga ang kidney. You have hydronephrosis tawag yun, no? So yung meron kang retention. That happens physiologic. Pag sinabing physiologic, that is normal. It will revert back to its normal.
Yun ba yung nangyari sa akin? No?
Yes, kasi yung physiologic.
For 2 days, hindi ako makaihi ng normal.
Kasi what will happen kasi, Rins, during the time that the uterus is still within the pelvic cavity, maliit siya. 'Di ba? So walang compression effect, hindi siya nadadaganan.
Correct.
Remember, mattress tapos sa harap mo pantog mo. So habang lumalaki ang bata, umuusad siya, tumataas siya sa pelvic pressure mo. So the pressure now is on the ureters. Yung ureter mo papuntang kidney mo. So as you go to the third trimester, minsan kasi nararamdaman mo, bakit
lagi ka
nawiwiwi ka because of that, mataas ang pressure mo, you can go up to 9 to even 20 centimeter water of pressure ng pantog. Kasi naiipit na ngayon eh. 'Di ba? Habang umiipit yan, tumataas ang pressure mo, nahihirapan kang umihi. Or sometimes, pag on a relaxed stage ka, pag nakahiga ka, kasi sabi mo, di ba, mas masarap pag nakahiga ka. Iihi ka na feel mo because ngayon, nare-release yung pressure. Di ba? Kasi pressure to the ano. Okay. So, you have that physiologic hydronephrosis na sabi. Ayan, tatayo daw ako kailan. So, ang ibig sabihin, mamamaga ang kidney mo, normal yan. Sometimes, your bladder tends to have a high pressure because of the compression ng uterus, mattress. Lalo na pag ang mattress mo ay retroverted, pabaliktad. No? Kasi normal, kasi antiverted, anti-flex. So what will happen is, plus yung hormones na nilalabas ng babae, no? Your progesterone has something to do with the sphincter in the bladder. Kaya minsan kasi, nagkakaroon ka ng physiologic incontinence. Ihi-ihi, hindi nakokontrol, di ba? Yung naramdaman mo rin, yung retention is because your progesterone have a interconnection with another hormone, which is your relaxin, sa bladder mo. So now your bladder has a physiological effect na parang, ay, hindi ako iihi muna because of certain compression. So what will happen? Magre-retention ka. So post-pregnancy, ang nangyari sa'yo, postpartum, yung after you still have that effect ng pantog mo. So, ang mafe-feel mo kasi, parang may retention ka pa rin. Kaya minsan kasi, pag nagre-refer ang OB, I tell them na, if you put catheter, anong gagawin namin? Lalagyan ba namin ng sonda? You can put yung ginawa straight
catheter.
Or you can put a transitory catheter for 7 days, then give relaxant. Relaxant is para yung sphincter mo, Beth Angel. Mag-relax siya. Kasi it went to a state 9 months na which is quite
Fresh
unusual.
siya.
Oo. So babalik siya. Hindi siya kasi pag pathologic kasi talagang may diferensya. So we have to understand that this is all physiologic because of your carrying a baby, unborn child for the next 9 months. Okay. So anong mga sakit na pwedeng i-refer sa amin? Number 1, yung sinabi, infection.
UTI.
That is happening because of the change in disparity of the hormones. Lalo na
Yun ang
female.
common
Oo.
UTI.
Your progesterone now goes up and your estrogen goes down, di ba? Because your progesterone will lay the foundation, naging obvious ako ngayon, lay the foundation of the uterus, yung mattress, kakapal ng kakapal for the baby and the placenta. So pag tumaas yan, your progesterone kasi interacts with other hormones, yung relaxin ng bladder, tapos yung ano. So what will happen kasi niyan, one is yung secretions mo. Diba? Let's do the secretion. Last few minutes. Yung secretion mo, you can have infection. Infections na very, very prone, no? Now, pag may infection ka, sabi natin, restrict antibiotics. Yes, you have restriction. You don't get, Now, you have to be very, very careful in giving antibiotics on account na mag-culture ka. Ako, I advise, if my colleagues will tell me, mga OB, magpa-culture ka. Culture, then give antibiotic if necessary. Pag hindi naman masyadong mataas ang infection, hydrate. Inom lang tubig. Mawawala yan.
Ako, Dok, paulit-ulit eh. Kunwari, may UTI ako ngayon, mag-antibiotics ako for 7 days. Yung whole week na after 7 days, wala. Tapos to check ulit, meron na naman.
This is after pregnancy?
No, before, while. During pregnancy.
Kasi nga, because of the hormonal changes mo, nagbabago
Does it also
siya.
contribute kung ano yung gender ng anak mo or doesn't follow?
No. Ang importante lang, we do not give much of the antimicrobials that we want because
But others would give suppository, diba?
No, the suppository is to prevent infection. Rather than give orals.
But have you ever encountered na kailangan ng emergency operation? Na, for example, may kidney
Sa
problem
amin kasi,
sa mother.
usually
So, what do you
nire-refer
do?
pagbato.
Pagbato?
Pag may bato sa distal ureter, nandito sa malapit sa ureter.
When do you do the
And
operation
it's very
after
painful.
manganak?
You have renal colic, you have severe renal colic, tapos yung mother is pregnant. Now the dilemma now is what is the duration of the pregnancy? 6 months, 7 months, 8 months. If you have a strong indication na kailangan operahan mo o you do endoscopic surgery, kailangan more of the full term. Pwede yon. But if it's in the preterm, magkakaroon, not yet. You give temporary, yung supportive for the stone. So, may mga support. Yes, oo. Yun ang kasi minsan hinihiling ng nanay, Dok, buksan mo na ako kasi masakit yung everything, no? You just have to check. You have to remember, meron tayong temporary physiologic hydronephrosis. Namamaga yung kidney. If you have a stone, you can attract infection. Sabi mo nga, if you have a pending infection, that aggravates the whole thing. Okay? Now, sabi mo, hindi mo tinanggal, mag-infection ka after pregnancy. Could it affect your baby? Yes. You have to inform the pediatrician. Kasi later on, your baby will have infection after postpartum. You get problems naman with the infant.
That's why yung baby ko, dalawa sila nung linabas, naka-heplock. Kasi may UTI ako nung biniyak. So, kailangan siyang gamutin for a week because of the UTI.
7 days.
Oo. Kasi mas susceptible ang newborn,
baby.
Lalo na pag transmission from the mother who is infected. Mahirap yun. Maliban sa incubate mo yan, we have to be very careful on that aspect.
Ayun. Thank you very much.
So, it's physiologic. Yun,
Yeah,
Information.
physiologic.